but now I'll transition into why we are here today, which is to announce our alternative dispatch pilot program that we do expect to go into moving beyond a pilot as we move towards the year of 2022. As I mentioned, we have been collectively working to provide an alternative approach and response to our residents and even visitors who are suffering from mental health issues and disparities. And so with that is also really reducing the time that NOPD has previously responded to these incidents in our community. Looking at our data very closely in 2019, we saw that over 3,000 calls actually could be redirected. 4% of the calls that we received through 911 were really for NOPD, like needing the assistance of our New Orleans Police Department. And so looking at that data and also understanding best practices across the country in regards to just the impacts of mental health in our community that are real, and also our ability to want to respond to them in real time, but also with the best alternative to respond to their needs. And we've recognized that it is not our New Orleans Police Department officers and even showing up in uniform. Instead, it is trained individuals trained to respond to, again in real time, to our residents suffering from mental health. And this will also free up our officers and allow them to focus on more violent crime in our community, and particularly just trying to leverage our resources more effectively, focus on force multipliers, again, so that we can redirect and deploy our officers where they're needed the most. This new alternative approach has the potential to improve outcomes for individuals who experience a behavioral health crises. So on last Thursday, August the 12th, the Orleans Parish Communications District, along with the New Orleans Health Department and NOPD, we began the pilot program focusing right now on the 3rd District. But it's in partnership with Metropolitan Human Services District for triage, treatment, and response. So as of now, as I mentioned, the pilot is focusing on our New Orleans Police Department District 3 until the end of that pilot. Right now, we're going to be assessing our effectiveness. I know last week we were expecting all these calls and we were like, wait a minute, just please call, because we wanted to try out, because we've been working so hard, again, to get it off the ground. And so we will pivot as necessary and fold in additional, expand our footprint as we learn more. But again, we're data driven every step of the way. So with this, I'm gonna let our director, Tyrell Morris, tell you a little bit more about our program, our response. You're also going to hear from Dr. Jennifer Vegno, our director of the Health Department, and followed by our Superintendent Sean Ferguson of the New Orleans Police Department. So without further ado, Director Morris.
Thank you, Madam Mayor. Good morning, everybody. Thank you, Madam Mayor, for your acknowledgement of Mr. Berryhill. He definitely was a hero for our city and gave of himself 100%. And we really appreciate your leadership during this time. This alternative dispatch program didn't happen by chance. The leaders of these organizations have been working for this for over a year, as the mayor mentioned. We applied some data and some science to what we believe is a program that will help meet our people where they are, but also execute our mission here at OPCD, which is very simple: to get the right people to the right place at the right time, better than anyone else in the world. All of our call takers are certified in emergency police dispatch using protocols provided to us by the International Academy of Emergency Dispatch. One of those protocols allows us to triage in an emergency someone that is experiencing a mental health crisis. And we've identified an individual that is nonviolent and has no access or mention to weapons probably does not need the intervention of a police officer. More appropriately, someone that is licensed and trained to handle someone in the midst of a mental health crisis. So our partnership with Metropolitan Human Services District allows us to do just that. If the call taker believes that your emergency fits this small box, well, not small, over 50% of the calls we get fall into that box, the call taker will conference in a mental health professional from Metropolitan who will take you through further triage. And then at that point, the mental health professionals will determine what the next best thing is for the individual. That may be a response. It may be setting up an appointment with a crisis or a mental health professional, or provide some more immediate care. But it also provides another opportunity for us to make sure that we do not have a life-threatening emergency. The crisis counselors will take you through an additional triage to make sure they don't have to send the call back to us for a more robust response. And so we do believe that we've covered our bases, and we're bringing this program to the public. We believe to increase overall public safety, but also be effective with our resources. We're excited. As the mayor mentioned last week, we were waiting with bated breath for the calls to come in. I will say in the first week, right, we've had 38 calls citywide that would meet this criteria. But we're focusing on the 3rd district, so only those calls in the 3rd district were sent to Metropolitan. We're evaluating on a weekly basis with all the agency leadership to see if and when it's appropriate to amp it up. But so far, so good. And with that, I'll turn it over to Dr. Avegno.
Thank you, Dr. Morris.
Thank you, Madam Mayor. Thanks to my co-directors. You know, this really has been a project long in the making. And I think the concept is simple. When your house is on fire, you call 911 and you get the fire department, because that is the type of emergency they are experts at. When there is a violent incident, you call 911 and you get our fine New Orleans Police Department, because that is what they're trained to do. If you're having a heart attack, you want EMS to show up at your door when you call 911. What we don't have, and where the emergency system that we have in this country falls apart, is when it is an emergency that is outside of those specific types. We know that our mental health system of care, both locally and nationally, has been quite fragmented. And there are people truly in crisis for whom this is an emergency. And deploying our other agencies simply does not meet the needs of that person or of their family, and in some cases can actually make things worse. So this is something that has been, that is starting to really take hold across the country in leading cities, to understand that this is a very different type of situation. It is a different type of emergency than the classic ones we're all used to, and it needs an appropriate response. And to continue to provide a response that doesn't meet the needs of anybody, it takes resources away from our first responders who are already stretched, and also doesn't get the patient the care that they truly desperately need. As I said, this is something that's being looked at all over the country, and we're very grateful that in the last year we've taken a deep dive to see what's working elsewhere. That's helping us build this, and starting small and building out seems to be the way that most are successful. I will say, when I talk to my colleagues around the country, once again, I'm proud to be a New Orleanian, because what I hear from them is, yes, we're excited to do this, but boy, we got a lot of pushback from our police department. Boy, we don't have a great 911 system. We don't have an integrated 911, 311 system, so that was really a challenge. And we've all been on board. Everybody recognizes the need. Ultimately, this is just the beginning. We know that the state is looking statewide at having a real integrated crisis system of care. Once again, we're proud to be leading in that way, and are planning to align our efforts with the state, but also not waiting for them, because we really don't have time to wait. So this pilot we're talking about today, we hope, as Director Morris said, to expand citywide, and then to provide other services around it to have the robust mental and behavioral health system that our community deserves. Thank you.
Thank you, Dr. Avegno.